So the question is, does stress really cause back pain? It's interesting because there was a large survey done in 2017 where they asked back pain sufferers what they thought was causing their pain. And the number one response was stress. It's interesting because doctors never diagnose stress as the cause of pain. They always say it's the spine. They always say that abnormal discs are causing the pain. So my question is, who's really right here, the well-trained professionals or the patients themselves? Well, let's take a look. The average price for back surgery in the United States in 2020 was approximately $70,000, and it can go as high as $150,000 or more. If they diagnose stress as the cause of back pain, the price they can charge is, well, basically zero. Medical doctors are not trained for, nor can they bill for, stress. Now, in my case, I was told by 3 spine surgeons that I needed back surgery for herniated and degenerative discs. It was really bad, they told me, and then they showed me on my MRI. However, back surgery has an extremely low success rate, so I didn't do it. I just suffered with a pain for years. I did eventually make a full recovery without doctors, and I'll tell you how I did it in just a minute. But first, let me give you what I consider to be absolute proof that the spine is almost never the cause of back pain. I don't care what your MRI showed, and I don't care what your doctor told you. The problem is not discs, but rather tight muscle tissue in the lower back. And the muscles have become tight because of prolonged emotional stress. It's almost too simple, but it's true. Let's take a look at 2 clinical studies that I think prove beyond any doubt that stress causes back pain. So there was a large study done in the early 2000s by the renowned Cleveland Clinic and then published in the New England Journal of Medicine. Now, in that study, MRIs were done on the backs of hundreds of test subjects. Half the subjects tested currently had back pain, and the other half had never had it. What they found was very, very surprising. The researchers reported virtually the same number of disc abnormalities, like herniated discs, in both the chronic back pain sufferers and the test subjects with no history of back pain whatsoever. So, to me, you'd have to conclude no correlation between disc abnormalities and chronic back pain. I mean, that's just common sense. That study alone, and there's been many others, should have stopped 99% of the back surgeries immediately. But no, the studies were ignored, nothing changed, and there are more back surgeries now than ever before. Here's another study done by the Journal of Clinical Psychology in 1995. In this study, they tested the relationship between emotional stress and muscle tightness in the lower back, trying to answer that big question, does stress cause back pain? So what they did was to attach sensors that measure muscle tension to the participants' lower back. Half the test subjects had a history of back pain, and the other half did not. Next, the clinicians engaged the participants in a discussion that was designed to create emotional tension. I don't know, maybe they talked about politics. Now, they discovered that participants without back pain showed virtually no muscle tightening, but the participants with a history of back pain showed almost universal muscle tightening as soon as the conversation started. Now, to me, these 2 studies combined prove both that discs do not cause back pain and that stress does. But I don't need any proof because I am the proof. I wallowed in medical care and back pain for years. And then one day, a friend told me about a diagnosis that I'd never heard of, a diagnosis called tension myositis syndrome. TMS refers to any chronic pain that's being caused by stress. There was a Dr. John Sarno who created the diagnosis in the 1980s. He cured thousands of patients and he sold millions of books. But Dr. Sarno was ostracized by the medical community because his diagnosis was a profit killer. In fact, there's a great documentary about him called All the Rage that you can find on YouTube. So like me, you most likely don't have a serious medical condition, just chronically tight muscle tissue in your back. And that's the best news of all, because once you figure this out, your body will go back to normal with no residual damage. I cured myself completely by focusing on just 3 things. I changed my belief about what was causing my pain, stress, not the spine, and then I reduced my stress level and I became more physically active again. Now, it took about 3 months, but it did work. I recommend reading Healing Back Pain by Dr. Sarno first, and also get our free guide that tells you exactly how to cure chronic back pain at paincureclinic.us. There's a link below. And don't forget to hit that subscribe button before you go. Thanks for watching.